Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hi, everyone. It's Nurse Paula. Thanks so much for joining me again this week on It's a Young Thing. And we like to talk about some various things that we do in aesthetic medicine. And one thing that we don't do in our practice is we do not do any kind of eyelash extensions or false eyelashes. One of the reasons why a lot of women like them is, it just makes you look a little bit more beautiful and your eyes look brighter and bigger. And they turn to false eyelashes a lot, even individual ones or the whole eyelash. And you can actually have some problems with those. You can get infections, clumps of your eyelashes can fall out. You can even get some irritation from the adhesives that are used to glue these hairs on your eyelid. So one option that we provide at Young Medical Spa is a product that's manufactured by Allergan. And if you know much about Allergan, Allergan is the manufacturer of Botox and Juvederm, as well as some other products. And the product that I'm going to be talking to you about today is an FDA-approved product to grow your eyelashes, and it's called Latisse. Now, it's only approved for the upper eyelid, and we'll talk a little bit more about that. The main ingredient of Latisse is called bimatoprost, and it is a prostaglandin, and it's for ophthalmic use. Mainly, it was made for glaucoma. And a prostaglandin is a very unique hormone. It's not a hormone that's secreted by a gland in your body. It's actually secreted at the site where it's applied, or where injury happens or where an issue is happening. So when you're applying that to the hair follicles on the eyelid, it's causing those stem cells to actually grow and produce a hair. And it's the only FDA approved lash growth product in the United States. It's available for sale in the United States and Canada. And my listeners here that are in Australia and the UK, unfortunately, it's not available for sale in your countries as well. Now, it is a prescription product. Now, this is what's really interesting about Latisse. Before, you just can't dispense this to somebody because you really have to be seen by a physician, and we need to medically rule out any kind of eye condition that you have that would make use of the product unsafe. Now, if you're pregnant, you don't use it. And pretty much when you're pregnant, we tell you not to use anything because it is a Class C drug. But we have to rule out any underlying eye disease that you should have because you just definitely don't want to use any kind of product like that around your eyes. And the other reason why we have you come in to get a prescription for this and to have an exam is that we have to properly instruct you how to use this product. Latisse comes with individual little brush applicators, and they're disposable. You use them one time and they get thrown away. And the reason why you do that is to prevent any kind of cross-contamination on your eyes. You never reuse the applicators over and over again. And we have to instruct you how to apply it, how much to apply, and how to put it on properly. Some uncommon side effects. Some people say, is it going to discolor the iris of your eye? It's uncommon. It really is uncommon, but it can happen. Some other uncommon side effects that really aren't that likely are if you wear contact lenses, it can discolor your contact lenses. You might have an infection in your eye if you're using a contaminated brush, if you're not using a clean disposable brush each time. You can also get hair growth outside of the treated area, maybe even a little bit of discoloration on your eyelids. Now, since you can only get Latisse by prescription after discussing your ocular health with your doctor, it's unlikely that most patients will ever develop any of these adverse effects. At least for a prolonged period of time. But if any adverse effects do occur, most of them are really resolved quickly once you stop using the product. Now, we have to caution you about using this in off-label applications. If you're, if it can grow hair in my upper eyelid, is it going to grow hair in my eyebrows? Is it going to grow hair in your head? Well, yeah, it pretty much can. A lot of people want to apply it to their lower lids, and we tell you not to do that because on Allergan's label, they tell you to apply Latisse in the evening. And the reason why they tell you that is when you close your eyes, when you sleep at night, some of the product is transferring from your upper lid to your lower lid anyway, and you're getting some of that product on your lower lashes areas as well. So you really should not do a double application to your upper lid and then also your lower lid. Now, some people have been using it on their eyebrows. And, this is really hit or miss. I've seen it work for some people. It's off label, and I've seen it not work for some people. I've seen it actually make some hair that's really fine, not a thick eyebrow hair, but just a very fine kind of vellus hair that really isn't the kind of hair that you wanted or you intended to grow in your eyebrow in the first place. So that's pretty much going to be a, your own risk situation if you want to try that, because, it can, applying it to other areas can cause hair growth to grow in unwanted areas, such as your upper lid, above your lash line, or below the lash line, or next to your eye if it kind of inadvertently drips out or smears out onto your skin. So, you really want to be careful if you're going to be experimenting on other parts of your body to grow hair. Now, most people see results in like 4 to 6 weeks. Because if you remember the episode where I talked about laser hair removal, we talked about how hair grows and how it's in cycles, and it has, the stem cells have to be turned on, and then the bulb starts manufacturing the hair. Then the hair's got to start coming up through the shaft, through the skin, until you can actually see it protruding through the skin. And well, that takes time. So typically with proper application, people will begin to see some results within 4 to 8 weeks, with the most dramatic results between 12 and 16 weeks. And people will say, all right, well, if I stop using it, what's going to happen? Well, if you stop using it, you're just going to basically go back to where your eyelashes were in the state, before you even started. And if you're using it longer than 3 to 4 months, you've been using it according to directions for 3 to 4 months. And, at that point in time, you can kind of taper down to every other day. Most people will have the same results. Some people go like every third day for application. Just play with it and see what works for you. I would say try every other day for about 6 weeks and see what you think. And then maybe drop down to about every third day. So like I said, if you stop using Latisse, your eyelashes are not going to fall out. They're not going to fall out in clumps. They're just not going to go crazy. They're just going to start going back to their normal fullness and length that was there before you started using the product. So when you think about that, it's going to seem like a huge loss compared to what they were, because you're going back to the normal state and you kind of forgot that what it was like. So I would suggest take a picture of your eyelashes as you start, so you're not really surprised at the very end if you decide, hey, I don't want to use this anymore. And you go back to the state that you pretty much were at when you very first started. So, consistent use of Latisse is required to maintain that extended fullness and the extended growth of your lashes. But, stopping the use of Latisse is not going to make your eyelashes fall out. So that is everything on Latisse and the proper use of Latisse and why you need a prescription for Latisse. It really is it's a medical product. It is a drug. It is not mascara. It's, not an over-the-counter kind of thing. It is something that you really do need to take seriously, and you really need to be properly instructed on how to use. Thank you so much for coming back again this week and listening to It's a Young Thing podcast. Make sure you subscribe to us. We are on iTunes, iHeartRadio, we're on SoundCloud, and if you missed an episode, you can always go to our website at youngmedicalspa.com. We have them all listed there on a podcast page. Thanks, everyone, for coming back this week, and we'll talk to you next time.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes, so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittman social media creation. SteveMittmanSocialMedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.